Hi, I'm Scott Murray. I'm a consultant cardiologist at Venturi Cardiology. We're in Warrington, which is halfway between Liverpool and Manchester. I set this clinic up along with my colleagues, and the idea came pre-pandemic to try and sort out a clinic which can see patients in a one-stop shop and can sort all your problems out on the day and save you coming back for multiple appointments. I became a consultant cardiologist because my grandfather died of a heart attack when he was in his early 60s. And I remember the grief that my dad went through at that time. And it had quite a large impact on me, even though I was only young. I started focusing on that when I was in medical school. So I did a intercalated degree in sports and exercise medicine, which started looking at heart in athletes, and I became interested at that point. And then whenever I finished my medical training, became a junior doctor, I came to Liverpool for a specialist training program in cardiology, and I never left. I think the most rewarding thing about the job is actually getting to sit and talk to patients and explain pretty complicated issues with the heart in very simple terms. I worked when I was a medical student in a pharmacy after school and at weekends, and I really cut my teeth at that point in terms of learning to deal with the general public and listen to them and really take their thoughts and emotions on board whenever I'm dealing with something that can be quite tricky. So I really get a kick out of when patients leave, and I get a sense that they really do understand what is going on and what needs to be done. So that's something that is the reason I get up in the morning. Patients value most just having the time to sit and talk things through and ask the stupid questions, because you don't get that moment in the NHS. You get 5 or 10 minutes on a telephone or in a clinic, and it's very much cutting to the nuts and bolts of it. And here at Venturi, the clinic appointments are, whatever you want it to be. It's normally takes about 45 minutes to get to the bottom of things and come up with a plan. And obviously, being able to having the luxury of being able to send people for tests whilst they're here and then bring them back into the room after they've had their tests on the same day and give them the answer to their anxieties or their worries, and to settle all that down in one appointment is really what the USP is here, and why I think we are pioneering in terms of how we're doing cardiovascular medicine. And this is how it should be done. You should be able to get everything done in the one day and go home with an idea of what needs to be done next. I really get a kick out of seeing patients, because a lot of the time they make my day because of just something silly they'll say, or something that they've mentioned, or learning about their past history and what's going on in their life. I can almost always relate to those things because of the family history that I have. We have a bit of a mantra here in Venturi that if you don't measure it, it doesn't get fixed, and that your DNA doesn't have to be your destiny. So you don't have to accept the fate that your genetics have given you. Yes, it contributes to 50% of what might happen to you, but the other 50% can be molded, can be changed through your lifestyle, your diet, medications, getting the right advice from an expert in that area.